everyone. My name is Tala Al Ramahi, an Associate Director within the Office of Strategic Affairs at the Crown Prince Court of Abu Dhabi, where I lead strategy for the global health and gender empowerment portfolios and oversee public policy in sectors such as education, governance, and citizen well-being. Through our office at the Crown Prince Court, we also oversee Reaching the Last Mile, a portfolio of global health programs working towards disease elimination that is driven by commitments from His Highness Sheikh Mohammed bin Zayed, Crown Prince of Abu Dhabi. The initiative provides treatment and preventative care in communities that lack access to quality health services, with a specific focus on reaching the last mile of disease elimination. To our viewers from around the world, welcome to the Abu Dhabi Sustainability Week web series. Our discussion today is not only timely but critical, as we witness the effects of climate change around the world, with its impact not only affecting the health of our planet, but the health of its people too. Our guest with us today, Martin, and I touched base earlier today, and he mentioned how the US Pacific Northwest heat wave has shattered temperature records, with many saying it is hard to deny that these are the fingerprints of climate change. According to the World Health Organization, between 2030 and 2050, climate change is expected to cause approximately 250,000 additional deaths per year from malnutrition, malaria, diarrhea, and heat stress. Its direct cost to health is estimated to be between 2 and 4 billion US dollars a year by 2030. Hunger, drought, and disease will afflict tens of millions of people within decades, according to a UN assessment that lays bare the dire human consequences of climate change. And while climate change has been an increasing priority within the global policy agenda, more can be said and done about how critical it is to address the intersection of climate change and global health. Martin, it is great to have you with us today. For the context of our discussion, and while this is a conversation about touching on the intersection of climate change and health, I think it is incredibly important to also frame this discussion around the incredible work that you do around malaria. Malaria is one of the oldest and deadliest diseases, devastating families, communities, and countries around the world. In 2019 alone, malaria claimed 409,000 lives and accounts for half of the missed days in African schools. The Crown Prince Court, through Reaching the Last Mile, is a proud partner of Malaria No More, the organization that you run with a noble mission to end all deaths caused by malaria. And so I am honored to be joined by Martin Edlund today, founding member and CEO of Malaria No More, to discuss the impacts of climate change and how it affects global health challenges around the world, especially on vector-borne diseases such as malaria. Martin, it is wonderful to have you today for this virtual conversation. Could you briefly tell us about what Malaria No More does? And of course, later in this conversation, we'll also talk more specifically about some of the new and exciting work that Malaria No More has been doing in Odisha, India. Welcome again, Martin.
Thanks, Tala. It's great to be with you. Thanks to you. Thanks to Abu Dhabi Sustainability Week, Reaching the Last Mile, and the Crown Prince Court for inviting us to participate today. You know, we were talking earlier about how appropriate it is that we're talking about the health impacts of climate on the morning after the highest temperatures we've had in the Pacific Northwest. It was 106 degrees here in Seattle, 114 degrees where my sister lives in Portland. And so we actually abandoned the upstairs of our home and we're sleeping on the bottom floor. We have concrete floors, which stayed relatively cool. So I don't know if you can see any of the debris. I tried to hide it, but I had to hustle my daughters out of my office where they slept last night to escape the heat. So I'm Martin Edlund. I'm the CEO of Malaria No More. As our name implies, we're an organization that's focused on ending malaria within our lifetimes. Or sooner, as quickly as possible. And our specific role is to mobilize the political will, the global resources and the innovations to accomplish that goal and live up to our name. As you pointed out, we're making tremendous progress, huge declines in malaria over the last 15 or 20 years. But as you also know, the job only gets harder as you move toward elimination. And so we need to be in the mode of relentless innovation to equip us to actually end this disease. And so today I know we'll be talking about one of those innovations, Forecasting Healthy Futures, a project we developed with the Crown Prince Court and Reaching the Last Mile. And the idea here is to use weather and health data to accelerate efforts to eliminate malaria and other mosquito-borne diseases. And I think it's remarkable, just how central conversations about climate and health are today, maybe especially in the context of the COVID pandemic. I was reflecting on how this conversation started between Malaria No More and the Crown Prince Court. I met your colleague, Mona Hamami, at the 2019 UN General Assembly in New York City. And this, of course, was pre-COVID days, and it was a moment when the world was focused on climate change and health. So you had Dr. Tedros of the WHO out there saying that climate change is already killing us. You had Greta Thunberg sailing to New York. You had pollution pods on the grounds of the UN building where you could actually go in and experience what it's like in Delhi or Beijing. And so, that was the start of a conversation that then continued at Reaching the Last Mile later that year, where we brought together a great group of partners. And I just want to give them a shout out at the top of our conversation. Groups like PATH, Tableau, IBM's The Weather Company, the Institute for Health Metrics and Evaluation at the University of Washington, great thought partnership from the US President's Malaria Initiative and the Gates Foundation and others, which led to the launch of this Forecasting Healthy Futures initiative in February of last year.
Thanks, Martin. Obviously, this conversation centers around the climate crisis and the intersection of climate change and health. So it would be great to understand from your point of view how you think the climate crisis is impacting global health challenges around the world, and which areas have been most affected by this.
Yeah, thanks, Tala. And you don't have to look very hard to see the impact of climate change and weather change on health. The World Health Organization has a 4-part framework for defining these impacts, and it includes things like extreme heat, very relevant for us today, natural disasters and variable rainfall patterns, changing patterns of infection. And if climate were considered a disease, it would now qualify as the world's leading killer disease, claiming more than 7 million lives annually. It's estimated that 9 in 10 people worldwide already breathe polluted air, and that pollution is responsible for 1 in 8 deaths due to stroke, heart disease, lung disease, cancer. And this isn't evenly distributed. In fact, these climate effects jeopardize most the people who are most vulnerable, people living in poor rural communities. I'm an optimist by nature, and so we do see some opportunity in these grim statistics. It's clear that climate change has emerged as the transcendent human challenge of our time, and arguably one of our greatest health crises. And yet, when you talk about the political debate and environmental changes, they tend to focus on long-term consequences, things that people find abstract: rising temperatures, rising sea levels, the acceleration of species extinction, increasing severe weather events. I think health helps us focus on kind of the here and now. It helps us focus on kind of tangible, measurable impacts. And if we can put health at the center of the climate debate, it makes the whole climate conversation much more relatable, urgent, and politically salient, because we're showing the costs of climate change to every person, everywhere, right here and now.
Thanks, Martin. I want to shift the conversation towards discussing as well another intersection within our global health work, which is on gender, and talk a little bit about why looking at global health challenges through a gender lens or gender equity lens is also quite important. With malaria more specifically, as I'm sure you know, but I think also worth reminding our viewers are that pregnant women carry a much higher risk than others. Women and girls experience differentiated vulnerabilities to and impacts of malaria, especially during adolescence and pregnancy. And because women and girls historically carry the majority of child care and childbearing responsibility, there is a knock-on effect when it comes to malaria, as well as many other preventable diseases. Many of these women have pulled out of their daily lives to care for these children. And this, of course, leads to an increased chance of compromising their schooling, missing out on many economic opportunities during their lifetime. So bringing a gender lens to malaria and other endemic diseases, I think, is crucial as well, and can accelerate positive health outcomes for everyone. So I think it's really important that we address hidden gendered educational, leadership, and economic costs of this disease to unlock new community assets and resources. I think it's also worth noting that while women often bear the brunt of many of the diseases and challenges in the global health systems that we are trying to address, they are also driving them as well, or driving the solutions. The majority of global healthcare workers are, of course, women, and many of them are poorly compensated, if compensated at all, and poorly supported. That is why we believe that gender parity is integral and an urgent part of what we do, in addition to addressing the intersection of climate change as well, in reaching the last mile of many global health efforts that we are trying to address together. I also want to just elaborate as well a little bit on how this has reflected on some of the projects that we've embarked on in the UAE when it comes to global health. Gender equity has become much more recently at the core of a lot of the work we do through Reaching the Last Mile, because we wanted to focus on an integrated approach to disease elimination. The need to reduce the burden on women and adolescent girls and create pathways for their full participation in the fight to end preventable and treatable diseases is placed at the heart of what we do much more recently. Through Reaching the Last Mile portfolio, we've also recently embarked on a new partnership to tackle chronic malnutrition globally. This partnership we've entered into this partnership with various UN partners, including UN Women and UNCDF. And unfortunately, chronic malnutrition affects over 149 million children worldwide. Again, women bearing the greater brunt of chronic malnutrition. They're at a greater risk at suffering from chronic malnutrition than men. And tragically, many more girls die from chronic malnutrition than boys. And of course, just bringing climate change into this discussion, again, unfortunately, recent reports have indicated that rising global temperatures are equal or greater contributors to child malnutrition compared to even poverty, inadequate sanitation, and poor education. So through this program, we are trying to unlock some of these global challenges and, of course, highlighting the many intersections between the various issues that we're talking about today. Martin, I think it's very hard to talk about global health without addressing the elephant in the room, which is the COVID-19 pandemic. COVID-19 has put a spotlight on our need to take action on climate change. And I want to ask you how the pandemic has changed the way you work within Malaria No More, and potentially on the focus of your particular work within the organization.
Yeah, thanks, Tala. And you're absolutely right that it's been, it's caused change in so many aspects of our lives, and certainly in efforts to eliminate diseases like malaria. at the start of COVID, as this challenge was emerging, so back in April of last year, the WHO raised the alarm and raised the prospect that malaria deaths could actually double in the context of COVID, as you saw the potential disruption of net campaigns and treatment-seeking behaviors for malaria. We were pretty concerned that 15 years of progress could be undone in a single rainy season in places like sub-Saharan Africa and India due to this effort. The good news is that thanks to the efforts of partners like the US President's Malaria Initiative, the African Leaders Malaria Alliance, the RBM Partnership, and others, people really rallied and responded to this moment. So there were 30 national mosquito net distribution campaigns planned for last year that were reorganized. PPE was given to the campaign workers, and they were able to proceed with those campaigns. In the end, distributing more than 200 million nets last year, maintaining a high level of prevention and a high level of coverage. The biggest challenge, however, is treatment seeking. COVID, of course, is a febrile illness, and so is malaria. In fact, malaria and COVID share 7 of 10 primary symptoms, starting with fever. And what happens when you have a pandemic, an emerging disease, is that people become much more cautious and they stop seeking treatment for more routine diseases like malaria. We saw this in the context of the Ebola outbreaks in West Africa. You actually had more incremental deaths from malaria because people stopped seeking testing and treatment than you had deaths from Ebola in that context. So there's a real fear that that would happen in the context of COVID. The Global Fund, one of our key partners in the malaria fight, has seen about a 17% decline in testing and treatment seeking through their survey of clinics. Through our work in India, we've actually seen much more dramatic declines, in some places as much as 50% declines in malaria testing in the context of COVID. And of course, India has just undergone a really severe second or third wave now of COVID. At the same time, COVID has also shown us some potential ways forward, some ways to build back better and ultimately strengthen our health response. We talk about the fact that in many of the hotspots for malaria, these rural communities, forested communities, are also the blind spots for the spillover of zoonotic diseases like COVID. And so as the world thinks about how to strengthen health systems, how to not only defeat COVID, but prepare for the next pandemic, we think that you can build on a lot of the infrastructure that's been put in place for the malaria campaign. Surveillance and data systems, and particularly a focus on frontline community health workers. This is they're working in communities, they're equipped with very simple and inexpensive rapid diagnostic tests for malaria. And so you're getting this signal on the front lines of whether you're seeing a spike in fevers and whether those fevers are malaria or some other cause. As Malaria No More, we've also responded by looking at the private sector. About 50% of the treatment seeking for malaria in sub-Saharan Africa goes through the private sector, through clinics and small pharmacies. And there was a real risk in the context of COVID that you'd have the mass closure of those frontline clinics. In places like Kenya, we saw 40% declines in revenues due to some of the lockdowns and the immediate aftermath. So one of the things that we did as Malaria No More, we have a practice called the Health Finance Coalition, and we're focused on innovative finance solutions, is we put forward a $35 million loan guarantee facility. So essentially backstopping loans to frontline clinics to give them working capital, to let them buy PPE, to do small scale construction, to separate potential COVID patients from pregnancies and other patients in their clinics. And so we worked with a great group of partners there, the US government, the US Development Finance Corporation, the President's Malaria Initiative, and USAID, but also private foundations. So Rockefeller and Skoll Foundations and the foundation of our founder, Ray Chambers. And so we think we're going to reach about 1,700 clinics with these working capital loans and ultimately sustain care for about 5 million people in the context of COVID.
Wow, that's quite impressive achievement given the challenges that the world has been facing through this pandemic. So massive congratulations, Martin.
Thanks very much, Tala. And Tala, I wanted to ask you, I know the Crown Prince Court was in the midst of a major global health campaign at the onset of the pandemic. And as everyone's had to do, you had to adapt your strategies. Can you talk to us about how your plans changed and particularly messaging in your communications campaigns needed to change?
Yeah, I mean, I think everyone has had to pivot in some way during the pandemic. When the pandemic began, we were busy ramping up for our Ramadan campaign. So this is, you know, an opportunity within our calendar to be able to raise funds. And we are raising funds for one of our programs called REACH, which is aimed at funding treatment for an NTD called river blindness. Historically, Ramadan has been one of the larger giving periods in our calendar. And unfortunately, the pandemic hit and we had to figure out how we shift our partnerships, which we had lined up. We had planned some major in-person activations, and we just had to really restructure how we were going to do things going forward. And so we started looking at how we can make giving safe, how we can provide a mechanism for people to give from at-home platforms. So our most successful campaign has been the Text to Give campaign, where we had people texting, messaging, essentially, committing to give. And that has proven to be very successful. We've also worked with various partners to activate their own online platforms, where we had online checkouts, where people could commit to donate to our campaign, as well as utilizing many of the social media apps, whether it was Instagram or more recently TikTok, which has been quite interesting for us because we managed to bring in a younger audience into this conversation and into the giving pledge for REACH. So we continue to do that, and it's been quite interesting seeing how we can address giving given the context of the pandemic and not being physically present to talk about the causes that we're supporting. And I think also working closely with our partners and adapting to each of their strengths allowed our campaign to organically flow mainly into a digital one again, whether it was leveraging their own social media platforms or creating specialized digital platforms within their organizations. So it has proven to be incredibly successful, though we were initially quite hesitant, I guess, or we weren't sure how successful such an endeavor would be. But obviously everything is turning digital, so it was a great way for us to really push our strategy forward to make sure that we can capitalize on that. So it's been a blessing in disguise in many ways, but obviously the pandemic still takes precedence in terms of how people think about where they want to give. And obviously COVID, for the time being, should take precedence in many ways. However, we'll continue to work on addressing the various intersections, as you mentioned, on how the pandemic has also affected other global health efforts and how they interplay into creating more sustainable solutions for everyone.
That's great, Tala. Congrats on that success. And I think it's a really important point you made, that the pandemic is forcing us to be creative, and in some ways it's accelerating changes that were due to happen anyway. Just briefly, we were gearing up for a monsoon season campaign in India, a health education campaign. You know, the rains come and that's when fevers spike and people need to protect themselves. And of course, in the context of COVID, you couldn't go and do the in-person communication that you'd typically do. So like you, we had to adapt. We worked with Facebook, we worked with the Times of India and Google and a few other top media companies. And we were ultimately able to reach about 150 million people through these channels and saw some really important measurable change in terms of prevention and treatment seeking for malaria with the onset of the monsoon.
Wow, that's quite impressive. Martin, I mean, you mentioned it, but I want to talk more about your current work with forecasting healthy futures. This has been a more recent endeavor for your organization, and we've been proud partners in this since day one. But I'd love for you to talk a little bit about what forecasting healthy futures is, and maybe also talking about how this intersects with climate change and the idea of disease eradication.
Thanks, Tala. Yeah, excited to talk about this and really grateful for Crown Prince Court's thought partnership and support for this effort. You know, the starting point for this is really recognizing the connections between climate and weather and disease transmission. The World Health Organization and the World Meteorological Organization have named malaria as one of the most climate sensitive diseases. And so we see changing weather patterns, even subtle changes in things like temperature, humidity, and rainfall affect transmission of not just malaria, but other mosquito-borne diseases like dengue, chikungunya, yellow fever, Zika. And so there's a lot of concern that in the long term, you know, this could mean that you're seeing risks of mosquito-borne disease carry into places that hadn't had them previously. So new latitudes and new altitudes. But at Malaria No More and through the Forecasting Healthy Futures project, we're really focused on the here and now. You know, it's not about what happens in 2050 or 2080. We hope to have eliminated malaria by those dates. But it's really about the challenges that changes in weather now present for disease elimination efforts. And you could actually make a credible case that malaria elimination and climate change are on a collision course. We're seeing that climate-related challenges like extreme weather events threaten to derail progress in malaria and other health priorities. You see really dramatic examples of this and all too frequently these days, hurricanes and cyclones that are happening more often and much worse than in the past. As you mentioned at the top of the conversation, at Malaria No More, we do a lot of work to support the government of Odisha. So this is a state in East India that, as of a few years ago, was the highest malaria endemic state in the country. It's actually emerged as a fantastic success story. They've had a 90% decline in malaria cases over the last 4 years. But as you get to kind of the end game for eliminating a disease, you need a strong health system. You need stable data systems. You need supply chains and delivery of those commodities to keep the progress going. And that, of course, becomes really challenging in the context of these severe weather events. So Odisha, each of the last 3 years, has had a major cyclone come through. In 2019, Cyclone Fani was perhaps the worst. That it caused the evacuation of over 1 million people in Odisha state. So it was a huge human challenge, disaster relief effort, and logistical challenge. And obviously something like that is incredibly disruptive to disease elimination efforts. It also brings with it severe rainfall and lots of times wreckage and other things that become breeding grounds for mosquitoes. So mosquitoes and mosquito-borne disease tend to thrive on disaster and in the wake of disasters. And so with the Forecasting Healthy Futures project, we're really focused on turning climate and weather-related obstacles into opportunities. So we're looking to harness really all of the data that's available to us, combine it with best available weather data to inform decision-making and drive progress in the fight against mosquito-borne disease. And, you know, in the world of malaria, the idea of kind of an early warning system or predictive system is something of a holy grail. It actually started about a century ago in India. Academics were looking at rainfall patterns and malaria patterns and trying to predict these things using the weather. What we're able to do now, though, is bring a whole suite of tools that didn't exist previously. So you've got much better epidemiological data. You know, we talked before about frontline health workers with RDTs and mobile phones who are collecting this data. You've got supply chain data and campaign delivery data, which shows you where your tools are arrayed and where you have gaps. Then you've got partners like IBM's The Weather Company and the Indian Meteorological Department that have years, sometimes decades, of detailed hyperlocal weather data that you can use to see patterns and plan campaigns much more effectively. And we're bringing new partners on board. So recently we announced a partnership with Cognizant, the technology consulting firm. We're calling it a Malaria Mapathon, where we're actually sending people into the field and they're mapping homes, standing bodies of water. So all of that can play into our strategies. And so you take all that data and you combine it with data science, data visualization tools, and machine learning. One of our key partners is Tableau. And Tableau makes it incredibly easy to take this complexity and turn it into maps, practical charts, things that can be used day in and day out by health decision makers, both at the national level, at the state level, and ultimately at the hyper local level. And so these changes aren't just theoretically interesting or academically interesting. They have really practical implications for how you fight a disease like malaria or other vector-borne disease. It allows you to time and target your interventions like net campaigns or screen and treat campaigns. It allows you to predict stock needs and make sure you don't have stockouts. And then, returning to severe weather events, you can also set a threshold and understand how much rainfall is going to disrupt routine health service delivery. In Odisha state, they have about 45,000 frontline health workers. They call them ASHAs. And so the ASHA workers go out and serve their local communities, but sometimes they're traveling a couple of kilometers to do testing and treatment and other care. And if you can predict with accuracy these heavy rain days when the footpaths are going to wash out, then you can plan ahead and make sure that it doesn't disrupt that kind of routine care that people rely on. And so just to close, I want to cite one of the things that we're excited about that's just happened. We just launched with the Indian government something called the Indian Interagency Expert Committee on Malaria and Climate. So it's something that brings together some of the top scientific and disease fighting agencies and the Indian Meteorologic Department and Odisha State to kind of work together to share data, to share best practices, and to see how weather data can accelerate these efforts. So we think between the work on the ground and the work that's happening at the national level to share data and set up policies, we're seeing the emergence of a model that could apply many other places. We're talking with partners now about taking this approach to West Africa and the Sahel region, which I know is a priority for the Crown Prince Court. But ultimately, this is something that could apply anywhere that people are getting into that end game and trying to harness data to eliminate disease.
Martin, it will be very interesting. Congratulations on the many successes of forecasting healthy futures. And we're certainly very excited to see how we continue to expand this program and also potentially the applicability to other vector-borne diseases utilizing big data in the way that you have in Odisha, India. So massive congratulations on this feat.
Thanks very much, Tala. And Tala, I'd love to kind of turn a question back to you. I know there's been a big push on addressing climate change throughout CPC's global health agenda. You've recognized this as kind of central and integral to disease elimination efforts more broadly. Can you tell us a bit about that decision and how it's playing out practically?
Yes, of course. I mean, obviously climate change, as we've already touched on earlier, has an incredibly severe impact on humanity moving forward, including outcomes on global health. Moving forward with our own disease eradication efforts, we've realized that without addressing the intersectionality of that with climate change means that we will not have the full picture and will not be able to make significant gains in global health outcomes. According to one report, 10 million more children across Asia and Africa will now suffer from malnutrition and stunting by mid-century, trapping a new generation with lifelong health problems, despite greater socioeconomic development. And specifically, when we talk about endemic diseases, over 2 billion more people are at the risk of dengue fever across Asia, Europe, and Africa under a high emissions scenario, whereas half of the world's population will be at the risk of dengue, yellow fever, and Zika by 2050. So just taking into consideration just how much climate change has an impact on global health outcomes, the choices that we make now are directly associated with climate change, as well as those that interplay with it. And so we must lay that foundation to address our portfolio when it comes to disease elimination. And of course, the UAE is a future-looking country that takes a thoughtful and innovative approach to what we do. And so this also includes making sure that the insights on this intersectionality are addressed. And we've been quite excited to embark on one of our first projects with Malaria No More to address some of the issues and intersections between global health and climate change, and are very excited to be exploring new opportunities in this field. So thank you again for your partnership and for your leadership within Malaria No More and forecasting healthy futures, Martin.
Yeah, absolutely. And Tala, I think there's, not to turn this into a brainstorming session, but there's a real opportunity for us to take the lessons we're learning, and we're kind of heads down on forecasting healthy futures on malaria, but then to think about mosquito-borne disease, vector-borne disease more broadly, and ultimately disease elimination efforts of all kinds.
Absolutely. Martin, maybe I'll close the conversation talking about the ambitious target that Malaria No More has to end malaria within our lifetime. What is being done to reach this goal, and what kind of support is needed to ensuring that this happens?
Thanks, Tala. You know, so this is my 15th year at Malaria No More, and it's 15 years since we were founded at the White House Summit on Malaria. And I was reflecting back on the early days of Malaria No More, and you know, we sort of you know, we bit off the big goal in just naming the organization, right? We didn't call it Malaria Little Less. We said no, we're gonna help put the world on a path to actually ending this disease. And the good news is, as you mentioned at the top of the conversation, we've seen historic progress in the last 15 years. More than 60% declines in malaria-related deaths. So this translates to 8 million lives saved, about 1.7 billion malaria cases averted, which in turn leads to $2 trillion in economic benefits because of school and work absenteeism and the other costs that malaria imposes, particularly on women and people in poor rural communities. One of the other milestones is that 24 countries have reached zero malaria cases since the year 2000. Highly relevant for this conversation, the first of those was actually UAE in 2007 that was certified by the WHO as malaria free. So we're seeing a shrinking map for malaria. We're seeing those kind of bright red hotspots muted a little bit as we make progress. But as we also recognize, we're not actually 60% of the way there, because the last 40% is the hardest and is going to take the most effort, energy, innovation, and ultimately resources. If one of the lessons of COVID is it reminds us of just how kind of quickly and completely these plans can be disrupted. And one of the takeaways for me is that we need to accelerate our efforts. We can't take 40, 50 years to get this done. We've really got to, in order to maintain attention and resources, we've got to do this quickly. COVID presents challenges, certainly. We're operating now in an environment of scarcity. Donor countries have spent about $17 trillion on their domestic economic relief efforts. African countries have faced 100 to 200 billion in additional expenses, and there's a lot of debt distress that's constraining budgets for health. But I think COVID also has a silver lining, and it demonstrates to us that as a human community, when we have unlimited resources, unlimited commitment and urgency, that we can get truly remarkable things done. No one would have believed at the onset of COVID that we would have not just one, but a number of highly effective vaccines for this novel virus so quickly. And as we look forward in the malaria campaign, we're asking ourselves the provocative question: what would it take to make the next 15 years the last 15 years for malaria? How could you accelerate efforts, develop new technologies and delivery capacities to get the job done? And I think if we can apply some of the lessons of COVID, to overcome regulatory hurdles and really get sectors working together, we're on the verge of some exciting new technologies, next generation vaccines that are more effective for malaria, monoclonal antibodies, which actually allow the body to fight the malaria parasite right as you're bitten by a mosquito and when you have the fewest parasites in your body. And then some exciting and certainly novel things like genetically modified mosquito technologies. And so, as we step back and look at the lessons of COVID, we hope that this sense of urgency, this recognition that health is central to so many aspects of our lives, that's not just applied to the newest pandemic, COVID, but what we would argue is the world's oldest pandemic, malaria, in the fight ahead.
Martin, it's been a pleasure having you today on a discussion that is both timely and incredibly important, affecting millions of lives around the world. I want to close by reiterating the sentiment about COVID-19 and the deadly pandemic, and that there is a silver lining, that there was a concentrated, urgent, and cooperative global effort to address an urgent global health issue in a way that we have not witnessed for a very long time. So let's hope that we can continue to collaborate on solutions to the other challenges affecting our collective futures, including climate change, as well as other related global health issues. To our audience, thank you again for being with us, and we look forward to having you join us for the next web series episode later this month. A reminder that a recording of this along with past episodes are also available on the ADSW YouTube page. Thanks once again, and thank you, Martin, for having us.
Thanks so much, Tala. Great to talk with you.